Hello, Connecticut, and welcome to the Paid Leave Podcast. The title basically says it all. I'm Nancy Barrow, and I will be delving into this new state program and how it can help you and your family. This podcast will give you information you should know about Connecticut paid leave and maybe just a little bit more. Connecticut paid leave brings peace of mind to your home, family, and workplace. Welcome to the Paid Leave Podcast. Today, we are talking about lung cancer. November is Lung Cancer Awareness Month. Lung cancer is by far the leading cause of cancer death among both men and women, making up almost 25% of all cancer deaths. Each year, more people die of lung cancer than colon, breast, and prostate cancers combined. Connecticut Paid Leave gives you income replacement for up to 12 weeks, whether you need to take care of your own serious illness or that of a loved one. Lung cancer certainly would be a reason to take leave from work to focus on your own treatment or if you're helping a loved one handle treatments. My guests are Dr. Omar Ibrahim. He is an interventional pulmonologist and a top lung doctor at UConn Health. Also joining us is Diahann Wilcox, a nurse practitioner and tobacco treatment specialist at UConn Health. Welcome to the podcast. Dr. Ibrahim, let's start with you. What does an interventional pulmonologist do?
So I started my medical training and I did internal medicine. And then after internal medicine, I did a training further in pulmonary and critical care. During that time period, there was an emerging field which really focused in on a procedural-based aspect of pulmonary medicine. And probably 90% of that dealt with patients with lung cancer. So after that, I did further training up at Mass General and Beth Israel in Boston, focusing on interventional pulmonary. So long and short of it, it's to help patients who need biopsies or need help clearing airways to allow them to breathe better when they're diagnosed with cancer, and then a few other benign diseases.
Like COPD, do you do those things as well?
Correct, yes. Yeah. So there's, for COPD, there's endobronchial valves, which we can help people who have really bad emphysema. There's other modalities. When somebody has some type of tightening or stenosis of the airway, we can open up and dilate their airway. Why
do you think lung cancer is by far the leading cause of cancer death among men and women? And is it equal?
So the reason why lung cancer is unfortunately so fatal is that when we find it, it's usually too late. Usually we find it in an advanced stage. So at that point in time, we're treating disease instead of trying to cure disease. We have, probably in the last 7 to 10 years, there's been a real push to try to identify lung cancer earlier. And in that process, the United States Task Force came up with a recommendation to screen patients who are high risk for developing lung cancer. They've changed the guidelines over the last few years, and they're actually making it more inclusive, trying to get more people into the guidelines. So if you're a smoker, you have more than a 20-pack year. So, if you smoked for 20 years, 1 pack per day, or smoked for 40 years, half pack per day, you would qualify if you're in the age group from 50 to 80 years old. And if you didn't quit smoking in the last 15 years. And the reason why I say if you quit for more than 15 years, your risk really drops significantly. And it's to identify those patients early.
It's interesting. My dad quit smoking at the age of 50. He smoked all the way up until midnight and quit and never smoked again, which is unlikely. I think he's in the minority, right? It takes people a couple of times to usually quit.
Correct. Yes. It's usually they're going to the doctor in a couple of weeks, or they just recently were in the hospital for something. So patients usually will stop cold turkey, which usually isn't the way to do it. It's getting help and making sure that they're supported through this process and really want to quit. Telling someone to quit and forcing them to quit is really not the best way to do it. The person really has to want to quit and commit to that and commit to a plan.
He did. It was really funny. It was all his idea. I mean, I hated that he smoked. And when he smoked in the car, I always was like, Dad, you're making me sick, and would always put the window down. But eventually, my dad did die of lung cancer, and they did attribute it to his 2-pack-a-day smoking until he was 50.
So yeah, unfortunately, you're really at high risk once you start smoking.
Yeah.
And then again, the more you smoke, the higher risk you become. There is a secondary cause which we can identify, and that's radon.
Mm.
And it's usually radon is it's an inert gas. It's in the soil, and what we're looking for is high amounts of it collecting. You can go to your local hardware store and buy a radon test, and basically it's like a filter, and you put it in the basement. You leave it there for 24 to 48 hours, and you send it out, and it tells you what your levels are. If your levels are high, you can put a mitigation system, which probably costs, well, I mean, before inflation was costing about $1,000.
Yeah. It's interesting too, because I think there's some people who never smoke and don't have radon gas in their home, and they still get lung cancer, which would be an environmental issue, right?
Correct. So up to 10% of patients can develop lung cancer who've never smoked at all or had a very insignificant history of smoking. Family genetics plays a role into that, environmental exposures, all those kinds of things do unfortunately play a role. And then there's a lot we don't understand really.
If someone is subjected to secondhand smoke, how much does that matter?
It depends on the amount of exposure. If you're spending, every waking moment with your loved one and they're constantly smoking, your risk is probably significantly high. But if you're, nobody smokes in bars anymore, but if you went out and smoked in a bar and went out once every 2 weeks or something like that, it's probably not that high. But it's definitely, obviously, it's become enough of a problem where there are other issues with smoking itself too. It can cause asthma to get worse. Parents who used to smoke in front of their kids would develop chronic health problems related to more inflammation than actual, cancer or something to that nature. So there's, lung health is vastly, how to put this, is vastly underappreciated. I think keeping an eye out for those things and being mindful, because we're exposing the air we breathe, right? It belongs to everybody, not just us, and we have to be mindful of that.
We do. I concur. What is the average age that someone might be diagnosed with lung cancer?
So it varies, again, because it's when you're finding it. So the best chance, again, the guidelines are recommending, we screen 50 to 80. And that's because when we can find it at that point in time, we can really make a difference in that person's life. And again, the goal is when we screen, it's identify, we catch it early to resect the patient with surgery, remove the cancer completely. And that being said too, we do find a lot of these cancers later on. They're advanced stage. When we do find them, typically at this point, more than 50% are found in advanced stage. The treatment options for lung cancer are vastly different than they were 5 years ago, 10 years ago. We used to treat cancer as you have non-small cell cancer or you have small cell lung cancer, and then we had basically regimens for both. Now we're looking at the tumor DNA, what drugs will work more effectively for this patient. Can they be on what immune therapy, and that essentially helps your immune system fight the cancer itself. Then there's these other options of, how do we treat these patients? We're fortunate enough where, at UConn, we invested a few years ago in platforms and robotic bronchoscopies, really to try to push forward lung cancer in the area. And I think we've done a great job. When I first started it in Hartford, I was the only one of me, or what I did in the area. And now I think there's probably 4 or 5 in the last 5-6 years. I think other hospitals have really realized the value that what this adds, and having somebody, lead the way. So when we invested in like robotic bronchoscopy, for example, 4 years ago, the initial goal was to start diagnosing earlier and helping patients do that. And we're doing that. And we've added different technologies where we're doing CAT scans during the procedure to look for therapeutic options for patients. Well, can we directly inject the tumor with chemotherapy or immune agents to help your body fight it? We're going to start a clinical trial in the next probably hopefully next 3 to 4 months, where patients who can't have surgery or can't have radiation, we can offer them an ablation technology where we're doing a bronchoscopy or kind of go with the scope and minimally invasively and burn the tumor, very minimally, and kind of same day procedure, they go home.
That's really impressive. That at least there's treatments are getting better.
Correct. Getting better, and like I said, I deal with a lot of lung cancer and a lot of stigma associated with lung cancer. Patients come in, and when I tell them, they think about their mom or dad or their relative who, by the time they told them and found out, they were, 3 months, 4 months later, they had passed away. And I try to reiterate, that's not you, and that's not, where this has to go. We're going to be aggressive, and we'll be, we'll fight with you. And I'm also honest, if there's a point where we feel like, this is something that we're going to start affecting the quality of life, I'm honest with them. And we have that discussion. Yep. And we want to make sure that, however long any of us have on this earth, we're making sure that there's a lot of, that it's mostly quality.
Exactly.
That's what we're trying to do.
Yeah. Are you seeing an uptick in lung cancer in our state?
So we are seeing an uptake but we're identifying more early.
Okay.
And I think that's because we're being more aggressive, and we're really trying to get those patients to move towards diagnosis rather than this watchful waiting.
Yeah. And are they getting younger? Because I know that like vaping's big, and now that marijuana is legalized, are you finding patients coming to you earlier with lung issues?
So definitely with lung issues. Lung cancer, I wouldn't say, but lung issues, yes. We don't know what vaping is going to do in 10, 15 years.
Yeah.
We don't know how that's going to pan out and what they're at risk for. But vaping affects you now. When we get patients coming in, it's usually younger patients, high school, college age. They're vaping, and those oils and stuff that are inside the material deposit into the lung and basically cause like a pneumonitis and inflammation of the lung, and it can be fatal. Unfortunately, we've had a lot of young people who've come in and they've passed away because the vast inflammation that it caused, and it's not recoverable. This
month shines a light on lung cancer. What do you hope it will do? Will it help get someone who might be in the guidelines to get screened?
So what I every time this month rolls around, what my goal is, what my hope is that we let as many people know as possible, because yes, ideally you want to catch those people who meet the guidelines, or who will seek self-help and come out and say, hey, listen, I heard about this, I want to know. But it's also to help their loved ones with some ammunition to go to their family and friends and say, hey, listen, maybe you should get screened. You're 55 years old, you have a heavy smoking history. Why don't you talk to your doctor or your healthcare provider and see if this is available for you? My hope is just increase awareness, right? And try to get people to go out there. And yes, I would love every patient to come to UConn Health and for me to take care of them personally. But that being said, we're a big state, and I think there are more than many capable physicians all over the state. And, if we can get patients to move into that direction and just talk to their doctors or their healthcare providers, we've done our job for the month. But we don't screen people once, only in November.
Right.
It's a year-round thing.
Sure. Yeah. Are there symptoms early on in lung cancer? I know you said that it's hard and usually they're found later on, like maybe stage 3 or 4. But are there any symptoms early on that people should be aware of?
So for the vast majority of the time, it's asymptomatic. Now, that being said, there are some warning signs. So if you've ever coughed up blood, that is a very high warning sign that you should talk to your healthcare provider. If you have this chronic cough that really isn't going away and you really weren't sick, you didn't have cold or a virus, and that cough lingered for 2-3 weeks, that's usually normal within normal limits. But the cough is lasting more than a couple of weeks. Again, you really want to talk to somebody to make sure there's nothing else going on, specifically in that high risk group, right? If you're a smoker, you have a family history of lung cancer, or you may be related to an occupational exposure, those kinds of things. Just reaching out and talking to your healthcare provider just to make sure that we're just giving you a good look over, early on.
Right. And are there different types of lung cancer?
So there's a lot of different types of lung
Oh,
cancer.
okay.
There are a lot of zebras, you don't see them very often, and there are
Mhm.
more common ones. Uh, the, lung cancer is divided up into small cell lung cancer and non-small cell lung cancer. Non-small lung cancer has two main types. It's squamous cell lung cancer and adenocarcinoma. Um, the vast majority of what we see is going to be a non-small cell lung cancer. So squamous cell carcinoma or adenocarcinoma. I believe adenocarcinoma is the most common type.
Mhm.
Um, but again, and this is, yes, we give these names, but when we take this tissue and then we send it to labs and we send it to specialized labs where they're looking at the DNA,
Yeah.
what is a medication that will act upon your tumor, not everybody's tumor? Grand scheme of things and where we're going to move towards is, this is many, many years away, but it's, doing some blood tests and trying to find out who are those really high risk people because their DNA is structured in a way where they're at risk. It doesn't necessarily mean that you're going to get cancer, but these are the people we got to keep a closer eye on.
Yeah.
That's where I think medicine will eventually get to.
And do you think if you have cancers in your family history, you should talk to one of your genetic counselors? I know there's a really great genetic counselor at UConn.
100%.
Yep.
If you're concerned at all, because multiple family members or one or two family members have, any type of cancer, reaching out and talking to a genetic counselor is 100% something worthwhile knowing. There's sometimes that leads to blood tests and knowing what they're looking at your DNA.
Yep.
Sometimes we find out things maybe we don't want to know, but sometimes we do, and that's a discussion to have with the counselor.
Yeah.
Because we want to make sure that we're comfortable with the information, and sometimes the information doesn't benefit you, but it'll benefit your kids.
I know you've been out in the underserved communities and tried to get people who are at high risk to get screenings. Are you going to be doing that again?
Yeah, so we here at UConn Health take pride in that, and we do events throughout the year to really just try to get people who can't necessarily come to the center or make people aware and make sure, because patients sometimes just have questions and they don't know if they qualify, and maybe they don't have access to their physician as much as they would like to. So we reach out and we do events to make sure that there's education going on. And I'll do a lot of events. A lot of family members show up again with ammunition to go speak to their mom and dad or their brother or so to really help push them into the right direction.
Are any minority groups more susceptible to lung cancer?
So we find that the African American and Hispanic community are not necessarily more susceptible, but the access to care is decreased. So we find a higher risk of later stage disease.
And have you helped people that when you've gone out to those underserved communities, have you found people who are at high risk and got screened and found out that they had lung cancer? You have.
We've found during these events we find people, and we take our navigators and we help push them through the system to make sure they're getting the same care that anybody should get. And there are disparities in clinical trials. We find that the access to patients who are getting clinical trials is low. So we have a push for that here as well to make sure that we're equitably providing that opportunity for all patients.
How do you think Connecticut paid leave can help patients and their caregivers with up to 12 weeks of income replacement? Do you think that will help them if they have multiple doctor's appointments or if they have treatments and someone can be with them?
100%. I think that the patients as well as the caregivers. I had a patient not too long ago who was a bus driver, and he was worried about getting surgery. Very curable disease with resection, with surgery. And he was worried about taking off work. He said, if I can't drive, I can't have surgery. How long am I going to be out for? If I'm out, then I can't do this. Maybe can I wait till Christmas or something where he has an inherent break in his schedule where he could do it. So I think, this would be amazing. It'd be amazing for patients to be able to say, I don't have to worry about providing because to help take care of their loved one. There are a lot of trips to the hospital, to the doctor's appointments and scans and, treatments that, do need to be attended to. And, sometimes that does get in the way of their care is because, logistically there's a reality of work and being able to be compensated for your time and not being able to provide for your other family members because you were caring for a loved one
Yeah.
or you yourself.
Yeah. Making that choice between taking care of a loved one or quitting your job, it's not a good choice. And Connecticut paid leave can help alleviate that.
And that's really awesome. It's the fact that, we're one of the few states in the country that will offer this is amazing. And I think that as you guys lead the charge, the rest of the country will follow suit. I have no doubt about that.
Let's hope we get a national program soon. How important is it to have caregivers and a good support system when you get a lung cancer diagnosis?
It's extremely important. It's a tough time that anyone's going through, and thinking about, well, what am I going to do? What's my next step? And having that support network is huge. I can tell you that the patients that have good support networks do better.
Yeah.
They do better.
Do you offer support groups at UConn?
We do. We do. We have a survivorship program. We also have a supportive services team here, and they're exceptional. A lot of people will hear supportive services and mean, oh, we're stopping care. We're just treating pain and whatnot. And that's not the case. They're there to help you through this process and help you with social situations, to help you with pain medications, to help you with anxiety, to help you with anything that they can do to help in this process. And they've done studies where they looked at patients who had cancer and had supportive services tied into that treatment really early, lived longer. So it's addressing issues as they come up before they become a problem really does help the patients overall. And then again, there are
fantastic.
Support groups that we offer, and then we have access to support groups if somebody wants to do something from home, wants to do more of a telephone call. We have those options for patients.
And any advice to someone or a family who has gotten a lung cancer diagnosis? What would you suggest for them?
Keep an open mind. Take as much information as you can. If you, in the process, as you're going through, if you have questions, ask. I tell my patients all the time, if you're not comfortable with what we're doing, you can't buy into what we're doing. So I need to make them feel comfortable. So if you have a question, you ask it. It's my job to explain it to you so you understand. And if you're not happy with me, and you're not happy with what I have to say, that's okay. And if you want to go get a second opinion, by all means, go get a second opinion. The most important thing is that we're all on the same page.
Right.
And as we're all on the same page, we can move forward and we can come up with a plan that works best for you as a patient. So it's keep an open mind, listen to information.
Don't go on the internet.
Yeah, exactly. Don't make a decision in a silo. Don't say, no, this is all I want to do. Make a decision that's informed, and it's having your provider help you with that. And sometimes it's, I spoke to the oncologist, I spoke to the surgeon. I'm going to go back and I'm going to talk to my primary care doctor who's been with me for, 7-8 years. And I want to hear what they have to say.
Yeah.
And I want to know what, and I think, again, having that information and, buying in, so to speak, is really what's going to help everybody in the process.
Thank you so much for being on this podcast. Thank you so much for your time.
Thank you very much.
Let's turn to smoking and smoking cessation and how to quit smoking and all that good stuff and how to prevent lung cancer. And our guest, Diahann Wilcox, a UConn Health nurse practitioner and tobacco treatment specialist. Thank you for being on the podcast.
Thank you for having me.
And how long have you been doing this, Diahann?
I have been helping folks quit smoking probably for the last 10 years, integrated into my practice of taking care of people with other pulmonary conditions, but I'm not always hard and fast with somebody's, with a quit date. I know that might be flexible, but let's get some ideas or I ask them, is there something that's specifically important for you coming up in the future and you want to reach that goal at that certain time?
Do you have classes or are there private appointments to get someone to quit? How do you?
I do both.
You do both?
I do both.
Mm-hmm.
So I have private appointments that people come to me and they often are referred by their primary care doctors or some of their other doctors that might be taking care of them. I do group courses that are for people who are ready to quit. At least for the most part, they feel like they're ready to quit. There's always that little bit of ambivalence to quitting. And it is 8 sessions I do it through the American Lung Association program called Freedom from Smoking. And we start with the first 4 sessions planning quit plans, putting together and designing a quit plan.
Mm-hmm.
Well, the first 3, actually. The 4th session is their quit day. So that's what I mean. They're coming in and they're ready. They're very serious about doing it. And then session 5 through 8 is all about supporting somebody while they are going through that process, problem solving along the way, because there will be, potholes and speed bumps along the way, helping, and they help each other, right? Again, I'm not there to answer their questions per se. I'm there to help guide them on, well, what do you think? What do you think went wrong? What can you do differently the next time? How can you plan for this situation the next time, so that you don't have a slip? And then I also help them when they are taking their quit smoking medications. When they're in the program, I'm not their provider, so I'm not prescribing for them, but I help to guide them with either over the counter products that they may choose to use, or any prescription medicines. If they're having side effects, I might help them with that, or recommend that they talk with the provider that prescribed it. So it's all of that. And I think that the support that each person gives to each other when they're in a program is really beneficial, and they really come together, and they're very sad when it's over.
Is there a family involvement? Because really, when someone is smoking, it affects the whole family. So is there kind of a family treatment to help the person stop smoking? Like, is there a support system with the family?
Sure. Whether it's individual counseling that I do, or sometimes it's been groups. At times people have included their family in with it. But yeah, I ask them, who's your support? Who's on your side? Who are the positive people in your life? So that you can tell them what you need and what is helpful and not helpful.
Right. The triggers that may make you start smoking again.
Sure.
Yeah. A lot of people say they smoke when they drink.
Sure. It depends on what it is. It might be their coffee. That's a big, there's a big association with tobacco and coffee, certainly with alcohol. And it's different with alcohol in the sense that, inhibitions can be lowered, and you might be in a location where you smoke, where you're allowed to smoke, depending on, where you might be. Although there's certainly not any bars anymore that allow you to smoke, but sometimes there's a private club or something that still will allow that.
Yeah. Or if you go to Europe.
Right. Yeah. Right. Or you're at a picnic and you're outside, or you're, someplace where it's, it's potentially allowable. Or even though you could be at a club or a bar, and all you got to do is go outside and find folks that are, that are leaving the club to go and have a cigarette and then go back in.
Yeah.
So, there still always are, risks and risky situations.
And when you quit, how does your body react? Like after a week or a month, or, the long-term 5 years?
Sure. Sure. So, in the very beginning, some people might have nicotine withdrawal if they're not using any quit smoking medication. So nicotine withdrawal in the first few days to few weeks can make you feel irritable, have less patience. It might make you sleep poorly. You just don't feel yourself and don't feel good. So when you use quit smoking medications, that can help to lessen those kind of things. And then eventually those kind of feelings will subside. But as time goes on, you will experience less coughing, less mucus production. People will have less infections like bronchitis, less wheezing. So those kind of symptoms can resolve in the few months after you quit smoking. maybe even less shortness of breath if you already have a lung condition that tobacco has, provoked. Over time, your risks for heart-related and vascular-related, such as, the legs, the brain with stroke, the heart, those things improve. And risk for cancers throughout the body go down as well over time. So that was one of the reasons why when I had said, after 15 years of being quit from smoking, a person actually is no longer needing to be screened for lung cancer because the risk for lung cancer has reduced significantly.
Do you think Connecticut paid leave would help your patients who may have to take time out for doctor's appointments?
Well, I think that making sure that a person can have time off from work and not miss out on being paid so that they can get this life-saving scan would be very important. There are times, that a person would make that kind of choice where they would put off doing a preventative screening because they don't necessarily see that immediate benefit where if they don't have, the full paycheck, that could be, a barrier for people getting their scans.
Yeah. And if someone has to drive someone, it's like if someone can take time off from work and help them, get them to doctor's appointments. So in hindsight, what would you suggest people do in this month since it is Lung Cancer Awareness Month? What do you hope to get out of this month?
Increased awareness that there is, an opportunity to be evaluated and find a disease early and save your life. So you have an easy test. It doesn't hurt. It doesn't take a long time. It helps to save lives. And hopefully, it sparks more conversation. Sometimes it can be enough to stimulate and motivate somebody actually to consider quitting too, if they are currently smoking.
Yeah. Are there free resources?
There are. So there's the Connecticut Quit Line. That is not just telephone anymore, because who talks on the phone?
I know, right?
But there is a telephone counseling that works on behaviors, helps. You can get, for a short period of time, free nicotine replacement products. But in addition to the telephone, and I also will say too, the telephone supports 13 different languages. So the good news, about telephone too, is that you don't have to go anywhere. You don't have any transportation issues, childcare issues, and you can be in your pajamas if you would like to. Right?
Make yourself comfy.
Right? Exactly. But then there's also online services through the Connecticut Quit Line as well. And then there's texting to quit, where you get daily tips for the day and check-ins. So there's resources out there. And these are not just somebody created an app. These are tested and validated ways in which people can get resources that help them to quit. These are the people that are on the other end counseling are trained counselors with years of education.
Thank you so much for being on the podcast.
I'm so pleased to be here. Thank you so much for inviting me.
For more information on lung cancer screening, call UConn Health at 844-777-LUNG, L-U-N-G, to discuss your health history. And for more information on Connecticut paid leave or to apply for benefits, please go to ctpaidleave.org. This has been another edition of the Paid Leave Podcast. Please like and subscribe so you'll be notified about new podcasts that become available. Connecticut Paid Leave is a public act with a personal purpose. I'm Nancy Barrow, and thanks for listening.